Hey everyone, my name is Sienna Boyd and we are back in the Choose Health studio. We are with Dr. Matt Combs, who is one of our hospitalists at Rancho Family Medical. And today we just want to get to know him. We want to get to learn all about him and how he began his interest in medicine. So Dr. Combs, can you please just explain to us, how did you first get interested in medicine?
Yeah, that's a good question. So my father is actually a physician in our group as well.
So is he the infamous Walter Combs?
Indeed, yes.
Nice, okay.
Yes. So, gosh, from infancy, I was around medicine.
Nice.
And as a child, I grew up running around the office, and actually Rancho Family office. And
Yeah.
just being exposed a lot to that.
Sure.
And also as a kid, you just want to be like your dad. So,
Definitely.
Growing up, I always had a little bit of that interest, being exposed to family medicine, and then also just wanting to be like dad.
Yeah.
And as I got older and got more towards the end of high school, that's really where you make those harder decisions. Like, is this
Definitely.
really something that I want to do, or is it just something that I'm doing to impress other people or make my parents happy? And is this something that will be fulfilling for me, or should I look into another type of profession?
Definitely.
And really the thing that helped solidify that for me is actually going on a medical mission trip to the country of Haiti.
Okay.
And my dad had been going for decades and doing some medical outreach in that country.
Okay.
And I went after my senior year of high school, was the first time that I went. And I was just blown away with so many different aspects of it. But the main thing, at least that pointed me towards medicine, was seeing how much good I could do as a physician and how much I brought to the table, and how, whether I was in America, whether I was in a different country, that I could walk into a city or walk into a patient's room and really potentially make a big difference in their life.
Change life, yeah.
And to have a career where you're able to support your family, but you're also able to make a difference every day you go to work is really the thing that I think inspired me the most to pursue medicine.
Definitely.
And that's really what kept me going through the many years of training, is kind of remembering that first experience, and then subsequent trips to Haiti. I've gone, I don't know, probably 20 something times. I'm not sure exactly how many,
Wow.
but going back there is just another good reminder to me of when you strip back all the bureaucracy of medicine, the paperwork and insurance stuff, and you really boil it down to what medicine truly is.
Yeah.
It's basically you being able to invest and make a difference in a patient's life, both on a mental health and personal level, but also on a physical level. And to me, it's just so rewarding.
Yeah.
And so both being exposed to that as a child, and then also going on trip overseas and really seeing how much good medicine can do is really what kind of drove me throughout my whole training experience. So
that is so awesome. That story is so great. And I can't believe you've gone to Haiti that many times and gone back, and that being something that solidified your joy of medicine that much more, which is really cool. So after you went to Haiti your first time, your senior year, or after your senior year, where did you end up going to school to practice medicine?
Yeah, so in order to be where I'm at now, there's a few different steps. So first you go to undergraduate college, and so I went to a liberal arts school in Santa Barbara called Westmont College. It was a very small school, very intimate feel, which is really the environment that I thrive in the most, because the professors knew me very well. It was very personal and really helped drive me. And
a beautiful campus.
Yeah, it's a great location too, that's for sure. And then after college, then you go to medical school. So that's another 4 years. So I went to Loma Linda Medical School.
Okay.
And for a number of different reasons, it's close to where I grew up. I really like their philosophy of making man whole, really treating the whole person and not just single organ systems or single medical problems. And so I did my 4 years there. And then after medical school, then you choose what specialty you're going into. So for me, I chose family medicine. And in family medicine, you train in a whole broad, so I chose family medicine. And with family medicine, you're really trained to take care of every gender, generation, and type of medical condition, really broadly.
Definitely.
So from babies to pregnant women to senior patients and whatnot. And to specialize, you go to something called residency.
Right.
And I did my residency training, which I became specialized in family medicine at Ventura.
Okay.
At a county hospital in Ventura, and had a great experience there, and really loved my experience. And then ended up back here, back home.
is this where you wanted to be the whole time? You knew you wanted to practice with Rancho Family Medical, or did you think you wanted to go overseas?
Yeah, so that's a really good question. That was lots of discussion and,
Definitely.
and thinking going into that decision-making process. My wife and I did have some serious conversations about moving overseas.
Wow.
Full time, and for a number of reasons, we decided not to
Okay.
pursue that. And this was really the logical choice. My wife's family is here. My wife grew up here.
Nice.
I grew up here.
Yeah.
Both of our families are here, and we just love this area and love this community and love this company. And so
Yeah.
it was definitely the logical choice.
Very cool. I love that story. So you came back, and so you are one of our doctors, and you practice out of our Hemet office, correct? And Single Oak.
Yeah. So
Okay.
I wear many hats with
Yes.
the group.
Yes.
So I work out of our Single Oak office in clinic. I work out of our Hemet office in clinic.
Mm-hmm.
And I actually am very involved in our hospital medical coverage. And so every day I'm usually at multiple different hospitals as well. So
Right.
I definitely bounce around quite a bit, and
Right.
and I enjoy that.
So you're one of our hospitalists that we have on staff. What does that mean to be a hospitalist with Rancho Family?
Yeah, so the term hospitalist essentially means that you're a physician working in the hospital.
Okay.
And in general, hospitalists only work in the hospital.
Okay.
Because it's a very unique environment and requires a whole different set of medical knowledge.
Definitely.
For me, I love variety, and that's why I like family medicine.
Yeah.
And so Rancho was gracious enough to allow me to do both. So I'm able to do clinic, and then I'm also able to work in the hospital.
Okay.
And totally different work environments, totally different type of medical knowledge, but both very exciting. And so I really like having that variety.
Okay, very awesome. So switching gears a little bit, what do you like to do for fun outside of the clinic, outside of the hospital? What takes up your time? What do you enjoy doing?
Yeah, so going through medical training, I succumbed to the fate of a lot of people trying to pursue medicine.
Not a lot of time for hobbies.
Yeah, you really start to lose a bit of
Definitely.
what you like to do for fun and what your hobbies are. And one of the joys of being out of my training now is having some more time to rediscover those things.
Okay.
And to discover new things that are enjoyable.
Yeah.
So I by no means am an expert in any of these, but some of my most recent passions is fishing. I love fishing, and some of my
Really?
staff get annoyed when I just go on rants about fishing, but specifically fly fishing. It's so fun. It's so interactive and
Cool.
peaceful and enjoyable.
Are there
So-
places to go fly fishing out here? Because I've never heard of places to go
Yeah,
out
so
here.
surprisingly, Southern California, you don't really think of much of
No.
a fly fishing area, but you can fly fish in ocean. So I do some surf fly fishing.
cool.
You can fly fish in lakes for all types of different fish in the local lakes. And then really within just a few hour drive is some really beautiful, amazing country, specifically in
Wow.
the Sierra Nevada mountains.
Oh, sure. Okay.
There's
Yes.
so many lakes and rivers to fish, and really
Yeah.
it's only about a 5-hour drive or so. So I try as much as I can to get up there and fly fish. I'm by no means an expert, but it brings a lot of joy. It's a lot of fun. And then likewise, doing woodworking. I think throughout the day I'm working so much with my mind
Yeah.
and having to think so hard that it's just nice to do something that's not mindless, but more relaxing and more with your hands. And so not only fly fishing, but woodworking is the same kind of thing, trying to create little pieces of furniture, little artworks or frames or
I bet your
whatnot.
wife loves that.
She does when it comes out, when it turns out nice,
Yeah.
she likes it. I'm still learning a lot.
Yes.
But it's just finding things that are distractions from the stress of life.
Definitely.
And there's a lot of pressure in medicine, and it really weighs on
bet.
you, feeling like, your decisions affect patients' lives. And so doing something that really just helps relieve that stress and that pressure is really beneficial.
That's so important, just to get your mind off of that and really to recharge so that you can be the best for your patients when you come
Yeah,
in during the
absolutely.
week.
And I think really what's best for patients is a doctor that takes care of himself or herself
Yes,
as well.
100%.
And we're notoriously bad at that. And
Oh,
so
man.
I'm really trying to relearn how to care for myself,
Yeah.
which really will make it better for my patients as well.
love that.
So those are a couple things. There's all sorts of other little things that I dabble in, but
Yeah. those are the main ones that you just really enjoy.
Yeah, just a couple things I enjoy, and just being outside is just great. And anything outdoors is just so amazing.
Same, I feel the exact same way. Switching gears again, what is your philosophy of care? If you were going to tell your patients, this is how I most want to care for you, how would you describe that?
Yeah, so I touched on it briefly with my training choices, and going to Loma Linda and their philosophy of to make man whole or whole person care is really what I carry with me still. And
that's awesome.
Looking at a patient as a person with emotions, with different belief systems, with different thoughts about medicine or not taking medicine, and various different life experiences, rather than just saying you have diabetes, here's the treatment X, Y, and Z. And so I really try and continue that philosophy that I learned in medical school into taking care of my patients. And what I've really tried to develop over the last few years, which I think at the beginning of my training I didn't do too much, and I had a few mentors that really started to show me this example, is really involving the patient in the decision-making process.
Interesting.
So instead of just coming in as this patriarchal doctor saying you need to do this, that, this, and this, and
which is kind of the traditional way of doing things as a doctor.
Oh,
correct?
totally is. And unfortunately, it's in a lot of medical training, you're kind of that mentality is just taught and passed down from generation of doctors to generation. And so
switching the narrative a little bit.
Yeah, really switching the narrative and getting the patient involved and saying, gosh, what do you think as the patient? What do you think would be the best option? Or how do you feel we could manage your diabetes better? Or what do you think about taking medication? A lot of patients are very against or hesitant to taking medication, and really trying to meet them where they're at, get their perspective, and try and come up with a solution and treatment plan that we're both comfortable with. I think not only makes the patient happier, but also improves the likelihood that they'll follow through with my recommendations. If I throw all these medicines at them and don't really explain why and don't go over their concerns, there's not a very high chance that they'll take all those medications. But if we're really discussing it and going through why and me asking what their opinion is and those sort of things, I really think it ends up causing the patient to want to participate or really buy in the treatment plan. And also just helps our relationship better, which I think is really important as well.
Well, if you have a doctor who not only gives you the time of day to really discuss those things and tell you why, but also a doctor who really shows that they care, I feel like patients would take their health a lot more seriously than, my doctor told me to take this, 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 and this. I don't know what it's for. I don't see the difference. I'm not going to take it, and I don't think their care would be as great. So
and it's a really difficult thing to do. So in medicine now, unfortunately, the volume of patients we see is so high that sometimes it just feels like, as a doctor, that you're part of a factory line, or even as a patient that you're just part of this factory line, right? And you're just coming in, you get a couple quick seconds with the doctor, and you're booted out the door, and here's your plan, go follow it. And unfortunately, that's just kind of the way medicine has gone a bit. But there's various different ways to mitigate that. And so I really try and fight hard against making my patients feel like they're just another number in the lineup of patients. But that's a constant struggle for every physician, every provider in the country, is to spend that quality time with patients, but also to keep up that volume. And so it's just a skill and a talent that I'm continuing to try and hone. We're really spending that quality time with patients, but being efficient and coming up with a good treatment plan that everybody's comfortable with. So
well, and that's why you joined medicine in the first place, really to care for people and that you can make a difference every day. And so we see that you're doing that with us at Rancho Family, which is just awesome. So if you are looking for another primary care provider, Dr. Matt is seeing patients at both our Hemet and our Single Oak location. Thank you so much, Dr. Matt, just for being with us and just telling us about you. We appreciate it.
My pleasure. No problem.